So we are going to be doing a newborn/infant assessment today with Sarah and her baby. For video purposes, we are using this cat, diaper included. And the baby is about 3 weeks old. She was born spontaneously through vaginal delivery. So we want to make sure the baby's comfortable and sitting or laying down, depending on how her mother is holding her and how she's happy. So we just want to ensure the baby stays happy and adapt to her through this assessment. So before touching or doing anything, we just want to count respirations, because if she is pleasant and happy, it's the best time to do it without any interruptions. Babies also do breathe through using their abdomen, so if you just want to place your hand gently on their abdomen to count the respirations, that would be a good technique as well, and you count for a full minute. So respirations in children as opposed to adult are faster, so a respirator 40 to 60 can be expected. We also are listening to rate and regularity. So at this time we also can be checking overall appearance, color, warmth, see if they're tracking with their eyes, if they're kind of focusing or looking away, or just showing signs of curiosity, which is all expected. We're going to also take lungs and heart. We want to just have the mother help in this, as we do need to kind of manipulate, checking the apex of the heart, just under her arm there, and then for a full minute, which is the best way to get a pulse. And we just want to be checking for the S1 and S2 sounds, which is the lub-dub. And like we said before, the color, warmth, and just to check the perfusion of the skin. We're going to be wanting to keep the baby warm to maintain their thermoregulation. And then we're going to be checking the head of the baby. We're going to be checking the posterior and anterior fontanelle, which are there still would feel like a gap in it, as they're not closed up yet at 3 weeks. And so we just want to be checking for, this is actually checking for hydration. So if it's sunken in a bit, it could be a sign of dehydration, whereas if it's kind of bulging, it could be a sign of extra pressure on the brain, which is also something that we don't want to see. And we also, as we examine the head and area, we also want to be checking if the birth was done using any forceps or vacuum. There might be some deformations that would kind of go down as the weeks progress, and so we just want to be checked that it is going back to how, like, normal, or normal for the baby. At this time, a lot of the assessment is just observing the baby to make sure movement and strength is there and the baby is developing as expected for 3 weeks. We could be using light to check her eyes for to make sure her pupils are equal, reactive, and to light and accommodating. We want to make sure that her eyes aren't moving sluggishly or there's any abnormalities there. Then we're just going to be doing a little bit of an interview. We're going to be asking about if the baby's been pooping and peeing normally.
Yeah, everything that I've been expecting.
And how many diapers do you normally go through?
It just depends on how much the baby's been eating. So kind of anywhere between 4 and 8 per day.
Wow,
Yeah.
8. That's a lot of diapers to change.
Overnight too,
Yeah,
right?
okay. And how's the baby feeding?
I'm pretty good, yeah. So every once in a while we have like a little bit of trouble latching, but it's been getting better every time.
Okay.
Yeah.
And if she does voice that she's having a little bit of problem, you could provide her with resources on breastfeeding and how to troubleshoot if she's having any problems with latching. And how has the baby's weight gain been?
It's good. It kind of went down a little bit after birth, but now she's kind of on the incline again. So I'm feeling she's kind of right at her baseline where she's supposed to be.
Okay. So normally babies do lose about 10% of their birth weight, and then after the first 24 hours they begin to gain the weight back, and within the first couple weeks it should be at least at the birth weight.
Okay.
Yeah. So then we would move to kind of more of a head to toe. We would palpate the brachial pulse, which is at the bicep bilaterally, just to make sure they're equal in strength. And then we'll also be palpating the femoral pulse, which is along the groin and along the diaper line. At this time, at 3 weeks, her umbilical cord should have fallen off and basically be healed, but we do just want to check that area. We can provide education on cleaning and signs of infection in this area, and ensure there's no skin breakdown or odor. And we just want to make sure that she is cleaning it with soapy water and there's no alcohol being used to clean it.
Yep, that sounds about right.
And do you have any other questions?
No, everything's been going really well. I am a little tired, but everything's going as expected. Yeah, it's been great.
Okay, and do you have support to kind of
Oh, yeah.
give you a break?
And lots of support. Yeah,
Okay.
yeah.
Sounds good.
Okay.
Okay.